Good day! Today I will be obtaining vital sign. First is getting temperature. These are the following equipment. Tray containing thermometer, jar of cotton balls in water, jar with tissue paper, and then waste receptacle. Watch with second hand and jot down notebook and pen. These are the following procedure. Read the chart. It is to obtain necessary data. Next is wash hands. It is to deter the spread of microorganisms. Determine any previous activity that will interfere with accuracy of temperature measurement. Smoking or oral intake of foods, fluids can cause false temperature reading. Next is bring the tray to the bedside and explain the procedure to the patient. When the patient know what is to be done, he will cooperate. Ma'am, good afternoon. I will be your practitioner. I will be getting your vital sign, your temperature, radial pulse, respiratory, blood pressure, and then next is runs the thermometer by using cotton balls with water in a firm um, motion from the bulb to the stem, and then dry using same motion using dry cotton balls or clean soft tissue. Chemical solution may irritate mucous membrane and may have objectable under odor or taste. Cotton ball or soft tissue will appropriate the surface, and twisting helps to come in contact with the thermometer's inner surface. Next is place tip of the thermometer under the client's tongue and along the gum line to the posterior sublingual pocket, lateral to center of lower jaw, and instruct him to close his lips tightly. So, ma'am, butaran na kasi mo mouth, ma'am, ha, sa ilalim sa dila. Close your lips. Uh, when the bulb rests against the superior blood vessels under the tongue and the mouth is closed, a reliable measurement of the body temperature can be obtained. An electric thermometer will signal beep with a constant um, temperature registers. Wait until 1 to 3 minutes for ordinary glass thermometer, allowing sufficient time for the oral tissues to come in contact with the thermometer result and more nearly accurate measurement of the body temperature. Remove the thermometer and wipe it at once with dry cotton balls or soft tissues from stem down to the bulb using a firm twisting motion. Cleansing from an area where are few organisms minimize the spread of organism to from cleaner area. Friction helps to loosen matter from the surface. Read measurement on display of digital thermometer. Inform client or watcher of temperature reading. Ma'am, imong ano is 37.5, which is beyond normal temperature. Next is um, cleanse the thermometer from the stem to the bulb using cotton balls with water twice, then dry with tissue wipe and return to the container. Dispose the use of cotton balls in tissue, paper, and the waste receptacle, confirming contaminated particles help to reduce the spread of pathogens. Record the temperature of the jot down notebook, report anything unusual. Wash hands. Record the temperature on the TPR sheet and graphic chart. Accurate documentation. It is accurate documentation allow for comparison of data. Next is auxiliary method. Here are the following equipment: tray containing thermometer, cotton balls in water, jar with cut tissue paper, waste receptacle, jot down notebook and pen, and clients washcloth or tissue wipes. Next na. Next is the procedure. Follow steps 1 to 5 of oral temperature taking. Next is expose arm and shoulder by removing one sleeve of client's gown. Avoid exposing chest. Pat the patient axilla dry with a washcloth or tissue. Place the probe of the thermometer into the center of the axilla. Bring the patient arm down close to his body and place the forearm over the chest. Moisture in the axilla may after the result of the temperature. The deepest area of the axilla provides the most accurate temperature measurement. Leave the thermometer in place until the signal or beep is heard or 1 to 3 over 1 to 3 minutes of ordinary thermometer. Next is radial pulse. These are the following equipment: watch with second hand, jot down notebook and pen, alcohol swab, and stethoscope. Explain the procedure to the patient to gain cooperation and make client at ease. Ma'am, today, kuha na po na ako imuhang radial pulse. Um, Next is have the patient rest his arm alongside with his body with the wrist extended and the palm of the body palm of the hand will downward, or place arm on the top of the patient upper abdomen with the pat abdomen position. This position place the radial artery on the inner spread of the patient wind. The nurse's fingers will conviction and the artery with will thumb in the patient the outer spread of the patient wrist. Apply enough pressure so that the patient the artery can be felt distinctly. And then moderate pressure allows the nurse to feel the superficial artery expand and contract with each heartbeat. Using a watch with a second hand count the number of pulsation felt for 1 full minute. Sufficient time is necessary to detect irregularities or other defects. If the pulse rate is abnormal in any way, repeat the counting to determine accurately the rate, the quality, and the volume. When the pulse is abnormal, longer counting and palpation are necessary to identify most accurately the unusual characteristic of the pulse. Next na. Record the pulse rate on the jot-down notebook. Refer anything unusual. Document the data. Next is respiration. These are the following equipment. Watch with second hand, jot down notebook and pen. Procedure. While the fingertips are still in place over the counting of radial pulse rate, observe the patient respiration. Counting the respiration while presumably still counting the pulse keeps the client from becoming consciousness of the breathing, which can possibly after the usual rate. Note the rise and fall of the patient's chest with each inspiration and expiration. This observation can made without disturbing the patient bedclothes. A complete cycle of inspiration and expiration constitute one act of respiration. Hinga. Using a watch with second hand count the number of respiration from 1 full minute. Sufficient time is necessary to obtain rate, depth, and other characteristics. If respiration are abnormal, repeat to determine accurately the rate, the characteristic of the breathing. Record the respiratory rate of the jot down notebook, including abnormalities in rhythm and depth, if any. Refer any abnormalities in rate or rhythm. Document the data.